microphone to Professor Shamim Kaisar for introducing Mufti Mahmud. Dr. Mufti Mahmud.
Thank you, sir. Hello, Mufti. Are you there?
Hello. Yeah.
Yeah. Okay.
Yeah.
Mufti Mahmud received his PhD degree in information engineering from University of Padova, Italy, in 2011. He is currently a senior lecturer with the School of Science and Technology, Nottingham Trent University, United Kingdom. Mufti Mahmud's current research interests include neuroscience, big data analytics, Internet of Healthcare Things, trust management in cyber-physical system. He has published more than 70 articles in high impact factor journals and international conferences. He is a senior member of IEEE and ACM, fellow of Higher Education Academy, member of Bangladesh Computer Society. He has released 2 open source toolbox for processing and analysis of recorded brain signal. Mr. Mahmud is an editorial board member of Cognitive Computation, Big Data Analytics Journal and associate editor of IEEE Access Journal. Now I would like to request Mufti Mahmud to present his slide.
Thank you very much. So, will you kindly share the slides?
Yeah.
Yeah. Hello, everyone. I hope you all can hear me and that there are no technical issues here. Am I audible?
Yes, sir.
Okay, great. Thank you very much. So, yes, good morning to everyone. Well, it's very good morning actually, because it's almost 6:45 here in the UK. So first of all, I would like to thank the organizers for having organized this forum on such an important and timely issue. I'm honored and humbled to be able to present along with leaders like Professor Shajul Kedash and Professor Muhammad Sharifuddin. I'm really humbled. Thank you very much. The very special thanks goes to Professor Shamim Kaisar, who is a very good friend and has kindly invited me to share my experience and my suggestions to the aspiring researchers who are here, and also share my views with the senior academics who are also listening to me. And definitely, last but not the least, thanks a lot to the IEEE Computer Society Bangladesh chapter for organizing this forum on such a timely topic. And again, thank you for the very kind introduction. Just reiterating to put things into context, I am currently in Nottingham, England, which is the second severely hit countries in the world in terms of the death toll. So, well, corona virus, the disease, the COVID-19 has very severely hit the country, and we are still in the lockdown condition, and is one of the countries which is actually experiencing a lot of difficulty in terms of healthcare delivery and treatment, delivery of the treatments. So coming to today's forum, actually the selected theme is fight against COVID-19 pandemic using machine learning, which translates roughly to application of data-driven approaches in combating the COVID-19 pandemic. So a relevant question that might be that what is the data science and how can from the data science perspective, we can actually not actually totally controlling the combat, but can we actually slow down what is actually going on, and assist the health system in whichever possible way from the technological and computational perspective. So towards these goals, my presentation today is going to be a very elementary introductory presentation, showing the pros and cons, okay, and introducing the pandemic trends and info, and then I'll just talk briefly about what data science can do in terms of its contribution in handling COVID-19 pandemic, and I'll point out some of the resources to the aspiring researchers who are waiting probably eagerly to explore and to contribute toward this combat and fight against COVID-19. And finally, I will just point out some challenges, and then eventually towards the end, I'm just going to briefly announce some of the possible avenues to publish the research which is being carried out. So as for the history of the pandemic, well, the world, this is not the first time that the world is actually seeing a pandemic. So there have been pandemics since the early 6th century, and there are a number of different ones which is happening throughout the human history, and well, the latest one is being COVID-19. So as you can see in the left figure, that well, that very small tiny dot at the bottom is actually the so let me just point it out. So this particular very small dot is actually the COVID-19 pandemic, and so it is, in terms of its effect, is not really that huge. So these are the good sides of what we know about the history of pandemics, and how much effect they actually had on humankind. And in terms of the death tolls also, well, this COVID-19 is not really the major killer. So here we can also see in the right figure that COVID-19 actually stays almost towards the end. So well, we know that the total death tolls have surpassed 300,000, and with the within the current context of improved healthcare delivery and all, this number is quite huge. But well, the positive message is, well, it is not the worst disease ever, but well, definitely we need to take measures to stay safe. Let's go to the next slide, please. So, well, in the list of the pandemics, well, we are very much concerned about the the pandemics, okay, the COVID-19 issue. However, well, there are a lot other pandemics and epidemic diseases are also going in parallel. So we simply are not aware, or we did that, as they do not concern us. We are just not simply aware about them. For example, here is a list published by WHO on the ongoing pandemic right now. So novel coronavirus is one of them. So as you can see, that there are over 20 pandemics which is ongoing, epidemic diseases which is ongoing, and novel coronavirus is one of them. So well, we know that it is serious, but well, we need to be aware that there are other things which is going on as well. So moving to the next one. So also in terms of the infection rate or the reproduction rate of the virus, well, we know that COVID-19 has been one of the very smallest viruses that we have known until now in terms of the infection. However, well, it is not the most infectious disease. So the reproduction rate, if we actually see, for COVID-19, which is at around 2.5, and this is something which definitely is higher than the MERS or the general influenza or the Ebola virus. However, well, it is well less than, for example, SARS or mumps or rubella, smallpox, or measles, which is having, for example, a rate of 16 in comparison to COVID-19, which is having 2.5. But again, well, we need to be scared because of the death tolls that is happening. Now we can see that disease death tolls per year is quite high, even in case of the diseases which has treatments. Okay, so for example, cancer, almost over 26,000 people every year die of cancer, despite that most of the cancers have um, treatments available nowadays. Well, that is where we need to be scared that, well, COVID-19, a disease which we actually do not know what is the cure. We have been trying out different medications, different treatments. However, we actually do not know what will eventually work. Well, there are lots of research going on developing a potential vaccine, but still we actually do not know where we stand. Well, next to us, Oxford University has started a vaccine trial, clinical trial, but well, we are still waiting for the results. Now, therefore, it is very important that we take measures as we do not have treatment. So, in terms of the risk ranking, okay, done by the WHO, well, I can see that, well, I can show here that that UK stands at number 3 there, and well, Bangladesh is standard at number 13. And well, as you can see that, well, as per the death tolls, UK being quite advanced in terms of healthcare delivery, is still the country with the second highest death tolls. Well, think about the United States, who is actually still unable to control the death tolls. So everywhere, thousands of people are dying with such advanced healthcare technologies. And therefore, well, in Bangladesh, are we really prepared? Well, that is something also in a research which showed that in the Asia Pacific region, in terms of the safety ranking, Bangladesh scores one of the lowest in the countries who are actually prepared to handle this particular pandemic, and it stays in number 18 out of the 20s. So from that perspective, it is actually very important for us to act early. Okay, so if we do not really act early, well, the effect which actually is put on the health system is really severe, and if we do not really take an early measure, the health system will break. Okay, so it will simply not be able to handle the overwhelming number of patients, and thus lots of people will simply die without treatment. Therefore, well, it is very much important to have necessary measures at the earliest possible intervention time. Okay, now within this particular context, if we go further, what can we do in terms of supporting the ongoing pandemic, and from a data science perspective? Can you go to the next slide, please? So, well, in this particular case, the data science actually plays a number of different roles. For example, it can actually be used in forecasting, in patient screening, in drug development, and many different applications. So we have a few very relevant questions to ask. For example, from the forecasting perspective, that from a data scientist or a computational scientist scientist perspective, what can we do to actually reduce the transmission? As I mentioned that, well, this is not the first time that world is experiencing viral outbreaks. For example, well, in the very recent past, in the last 10, 15 years, we also had the influenza pandemic in 2009, and then the MERS coronavirus, the Zika virus, the Ebola virus outbreaks. And given that the data that we already have, I know that, well, Professor Das has presented a very rich research on modeling how the transmission trend is. So we can actually, following the similar paths, we can have a transmission pattern and predict the possible future transmission patterns as well, and alert the relevant authorities and notify them to be prepared to take necessary measures in controlling the outbreaks. So, well, in terms of forecasting, we can do that seamlessly for contact tracing, simulation and modeling, then understanding the social interventions, that social distancing and other regulations which are being already put into place, then logistical planning and economic interventions, which are also very much important, because, well, if the logistic breaks down, if the supply chain breaks down, then it is something which is going to have a very devastating consequence. Then, so, well, can we actually automatically identify, for example, pandemic hotspots and reduce the infection? So that is something which is very much important within this particular context, given the popularity of social media and the increasingly large amount of media coverage. The information in combination with other personalized services such as healthcare service data. Can you go back to the previous slide, please? Yeah, so personalized services such as healthcare service data, we can actually identify the ongoing pandemic hotspots and reduce the traffic in those specific areas. So that is something which can also be involved within the logistical planning and applying the social interventions. Now, in terms of the patient screening, so it is very important to actually assess the risk and identify the population who are actually more vulnerable to this pandemic, and how can we prioritize this particular screening process. So the relevant question would be that can we identify a suitable population for screening rather than doing a mass screening, especially in countries like Bangladesh and in India and in low and middle income countries where resources are very constrained. Well, even in the UK, the resources right now are very constrained. They are aiming to test 100,000 people every day, but, well, theoretically they actually have reached that limit, but practically there are lots of questions regarding that. So we can understand that there is a lot of burden on the resources. So can we actually identify the suitable population for screening rather than performing a very mass screening, which is always very difficult. So from the perspective of then optimal research allocation, it is very much important, and then towards that particular goal, we can actually take a look into the various sensor informatics and data coming from wearable sensors, from mobile phones, and from other portable devices for monitoring the prospective and asymptomatic and mild symptomatic people through mobile apps or other relevant avenues, and collect those data and perform sophisticated analyses using machine learning techniques to identify the more vulnerable communities, and then provide specific services in those communities rather than overburdening our intensive care units. And so once we actually have identified the vulnerable communities, we can try to provide them with the necessary testings. But, well, what happens to the ongoing patients? I mean, who are already there? So if now someone is complaining about shortness of breath. Is he really a COVID-19 patient, or is he also suffering from some other respiratory issues maybe? So from that particular perspective, well, can we, from the data science perspective, actually assist this diagnosis process? So following the computed tomography or X-ray imaging data, as many of them have been made available, which we'll discuss shortly. So we can actually support the COVID-19 diagnosis process. But well, we'll have to keep in mind that, well, the machine learning methods which are being applied on diagnosing these specific um, um, the COVID-19 through these specific avenues are not 100% diagnostic tool. So we'll have to keep this in mind, and we'll have to seek for further clinical validation. So these should actually be taken only as a main of assisting the ongoing testing and diagnosis process. And then that is something which could lead actually then automated patient screening. And well, the other point would actually be, well, can we use some bioinformatics approach to also facilitate the drug development or vaccine development from the data science perspective for combating this pandemic. Now, in terms of the resources, well, there have been, thanks to the collaboration of many different countries, many different researchers, scientists, that they have made a lot of data available online. So as of now, we can see here a very brief table that I have tried to put together very within this small amount of time that I had. So we can see actually a number of data sets, which indicates that there are data sets related to CT scan, a number of them. There are the data sets related to chest X-ray, and then lots of case statistics are there coming from different places, different countries, different regions. We understand that, well, this pandemic is not happening in all the country at once. Well, there is a lag and or delay in how it is happening in different countries. So why not learning from the country who has already gone through the intervention and the handling of this pandemic? So from that perspective, well, we can very well use the statistics and the data which are being presented in this table. I would be very happy to share this, whoever is interested. Okay, so this is something which would be very much useful for running ongoing research or starting the research based on the available data. Now, there are a lot of challenges as well. So towards those challenges, this Kaggle actually has released a number of data sets. There are mainly, let's say, three basic categories that or challenges that have been introduced. The first one is actually trying to let's say understand the rich literature which has already been published over the years on coronavirus. So all those papers, scholarly articles have been released as a data set, and that is something which is open for everybody to download and use as a challenge. Okay, then there are a prediction forecasting, global forecasting also challenge which is going on. For example, well, from the data that has been released within from April 9 to May 7th. Okay, so there are a lot of case data and by city, and well, can we extract those data and actually make use of those data to predict how the transmission pattern is taking place. And then the third one is actually it's an exploratory analysis to ask many different research questions and the frontline responders to support the frontline responders. Okay, so these if someone is interested, because well, Bangladesh has got a lot of potential, and well, in the various programming contests and everywhere, Bangladesh has been coming out with flying colors as leading performers. So these are the data sets which are openly available. Why not making good use of them? So these are the challenges where we can also participate and then contribute. So moving to the next one, we have the though the list actually goes on and on. So just being aware of the allocated time, this is going to be the last list that I am showing. So there has been a communal effort, as I mentioned before, in terms of gathering this data and putting this data and making them available for the research community. So as you can see that, well, there are a number of natural language processing data sets. So these are mainly resources which can actually be downloaded freely, and then, well, you can just simply work on them and try to predict some of the patterns which are taking place. I mean, that is something which can support the ongoing fight against COVID-19. Now, there have been some analysis and tools also have been released and made available for people, for example, for graphing, for visualization, and for certain analysis. So that is something which also actually can be handy in trying to address trying to support this fight. And there are a number of different resource pages. Well, due to the space shortage, I only have put two. So one is the John Hopkins University resource page, and the other one is the WHO resource page. And then there are also a number of biomedical data sets who are aspiring bioinformatics scientists. They can actually download the biomedical data from there, and then there are lots of telehealth aspiring researchers here as well, I assume, and they are the ones who can actually have a look into the telehealth data set. Now, moving towards the almost the end. So there are a number of different challenges which actually come along with the given role as a data scientist we need to play. So first is data scarcity. Well, we are talking from the data science perspective. We are talking from a perspective of machine learning, and we're teaching the machines to predict something, but, well, we do not actually have enough data. So, well, if we keep the natural language processing data sets apart, and the social media data sets apart, then, well, the other data sets, for example, if we are taking the daily cases data, or even if it is we are taking the radiology data, the amount of data that we have are very limited. And also the sample size is very limited. For example, probably, well, the people who, out of their generosity, they made the data, the chest x-rays or the CT scans available. Probably they could do it only for 60-70 patients, because there is a lot of data protection regulations. So the sample size is very limited. And also, well, as we know that the disease, the coronavirus disease, it has different strands in different countries. For example, in Bangladesh, it is different from how it was in China. In Italy, it is different from how it is in the United Kingdom. In America, it's even different. So there are a number of different mutations of this virus. Now, how that is going to be taken into account within the changing localized context. So that is also something which is an research question, and can actually be addressed. Now, well, we actually also need to address the correctness of the results versus the urgency. Well, we all need something to be done. We are really very motivated. We want to do something. However, well, we are producing results. Now, well, how accurate are those results with regard to the standard rigorous process of verifying those results? So that is something which needs to be taken into consideration very seriously. And, well, we, as I mentioned, that we actually have a very small data set. So we might be running into a problem of overfitting. So, well, we are probably saying that, well, my model, the machine learning model that I have fit, has got an accuracy of 99%. Well, but is it really getting an accuracy of 99% over the all population? Is it generalizable, for example, for the patient from all different parts or affected areas? So that is something which we actually need to address. and is it also something that we are just following the trend, and while we are motivated, we are aspirant, and this is the time to do some research, and therefore we are just trying to do some research on COVID-19, and that's it. So well, we'll really have to be cautious and present something which is very much important. Now towards dissemination approach, well, I would say that, well, we are very happy to announce that we are actually guest editing a special issue on data-driven and AI approaches to combat COVID-19. So, well, I would like to invite the audience here to contribute actively into this special issue, because this is going to be a very good avenue to showcase the research, the excellent research which has been done in Bangladesh. So I would appreciate your contribution there. Okay, and well, we actually have another special issue which is ongoing with a deadline of 31st of August, where we are talking about, we are expecting papers on advances in deep learning for clinical and healthcare applications on the same cognitive computation journal. And well, any deep learning based method, not only addressing the COVID-19, but in general clinical and healthcare aspects can also be submitted there. Additionally, well, we actually have another rolling basis special issue in Brain Informatics Journal, where we are really trying to see neuroscience, machine learning applied on neuroscience data. So well, I would also like to invite whoever is working on the science field to that. And along with that, we actually, I would like to introduce or announce a couple of conferences which are coming with some coming deadlines. So there is a Brain Informatics conference which was scheduled to be held physically in Italy later this year. Well, but it is not going to happen physically in Padova now, where we are moving to an online conference. And therefore I would invite you all to contribute to this conference. Well, the registration fees are going to be very low, because it is a non-profit conference. Okay, so we are just aiming to cover the costs, as we will not have much cost for the online conference. So well, the registration fee is going to be really very low. So I would invite you all to contribute there. And the last one that I'm going to show here is actually computational intelligence in healthcare and e-health, which in December is going to be held in Canberra. And hopefully, well, this one probably will be held in person. So I would invite you all to submit papers in this one as well. And any research regarding here would be very much welcome. With this, well, I would like to thank the organizers again for having me having me here and giving me this opportunity to put my 2 cents towards this audience. Thank you very much again. And well, if there are any questions, I'll be very happy to take them. Thank you.
Thank you very much, Dr. Mufti Mahmud, for your stimulating speech and also for your time. If you have any query, please feel free to ask Dr. Mahmud. Dear audience.
Sir, MD Sulaiman Mia. Sir,
can you please? Yeah.
Okay. Thank you, sir. Thank you, Dr. Mufti, sir. I am Mohammad Sulaiman Mia, and I have graduated from the Department of CSE, University of Dhaka, and I am currently working as assistant professor in Green University of Bangladesh. So, first of all, I want to say that we are going such critical conditions in the social, economical, political, and most importantly, the mental conditions. It is very appreciative that you have shown some data in the lecture of your previous slides, the first previous slides, that is quite in positive move, and it gives us quite mental peace. And you mentioned in your lecture that the COVID-19 is not the worst disease ever. So it is quite positive move. So my question is that is it possible to predict the number of total deaths using any tool in machine learning? Possible to predict when it will stop spreading?
That
Thank you, sir.
thank you very much for your question. Well, I think that there is a question which is which we are asking, to be honest. Well, reach its forced, and that what is going to happen. Unfortunately, the amount of daily, for example, infection or whatever data that we have is way too less for any of the machine learning based models to train and then give us that particular information. So we probably need to look it from a multi-sensor data fusion perspective, and then probably that is something which will be able to shed some light onto that scenario. But well, as of now, unfortunately, well, there is nothing concrete that can be said that, well, we actually know absolutely that, well, what is going to happen in the future. Hope that answers the question.
I have a question. May I?
Yes, please. Yeah.
Okay, thank you for the nice presentation. I'm Ahad at this moment from Japan. So the question is that we have some X-ray related works on COVID-19, but my prediction based on a little bit experience on medical imaging and others, that is it logical to explore X-ray based data for COVID-19 research based on the previous lung related diseases in the history? So number one is the data set is small, but this is not the number one problem. Number one, the possibility or prospect, it seems not so much. What do you think? This is
So well, I very much agree with you. I could not actually agree more than what you actually have commented. Well, the data set is small. Well, we also have actually a paper where we tried to apply some conventional image analysis techniques to predict COVID-19 from CT images. However, well, this is something. Can we really trust it? Well, there is still a question mark, to be honest. Okay, but as I said, that well, we will have to be very careful. We cannot use this as an absolute mean to detect the disease. It can only be used to identify a potential population, maybe. Okay, so from my perspective, this is my personal opinion, that we can probably use the available tools to maybe provide a from a decision support perspective, that well, we present that, well, this is what looks like a COVID-19. So can the doctor be actually focusing on those probable candidates to further examine and make sure that there is something which is COVID-19, but alone using the imaging modalities, I am also not really very confident that there is something which will allow absolute results in terms of whether a person is COVID patient or not. So hope that
thank you
answers
so
the
much. Yeah,
question.
thank you very much.
Welcome.
We have three more questions. Now I would like to request Professor Lafifa Jamal to ask question to our speaker. Professor Lafifa Jamal.
Yeah. Can you hear me?
Yes, I can. Yes, please. Yeah.
Yeah. Okay. Okay. Thank you very much for your wonderful presentation. Like you mentioned that the contact tracing information can be used for the forecasting purpose, but there is a debate like the privacy issues of using contact tracing information for data analysis. So, as a data scientist, how do you see these privacy issues and the analysis part? What's your opinion regarding these privacy issues?
That is actually a very important question, and well, I due to this crunch of time, I could not just cover that particular part. So in my slide, I actually had a point where I had to talk about the privacy and security aspects and ethical aspects of the ongoing data science research that involves COVID-19. Now, well, given the situation, even if we collect data which are anonymized from the specific devices, well, there is this concern that, well, these sensor data still remains open in terms of whether we can identify the participant or not. Yes, we can actually up to a certain extent identify the participants, but however, we from the ethical perspective, the data scientists will have to be very much concerned and very much careful not to share those data with any third party. For example, whenever we are on the web, we are actually leaving our signature everywhere. But well, the companies, they actually do, let's say, ensure us that we are safe, and they are not going to sell our data to third parties. Though, well, within the uh, uh, quote, I want to say that, well, that does happen sometimes. But well, we from the academic perspective will have to keep it very tight, that well, we'll have to abide by the ethical standards and keep the privacy and standard very high, and um, uh, hide the identity of the people from whom the data is coming. So yes, there is a huge concern about that. But given the let's say given the situation that we are going through now, it is actually important to identify and support the people who are vulnerable and who can actually be infected by the disease, than actually protecting their identity. So that is something which will have to remain with the authority and with the scientists, not to be revealed or sold to any third party. But that is something which is a concern that we really need to keep in mind. Yes, thank you for raising that. I appreciate it. Hope that answers your question.
MD
Professor
Faisal Ahmed.
Yes, thank you. Sir, actually, I have a question. I am working with a machine learning project at the COVID-19 X-ray detection. Sir, I saw some data set at online, but there is not enough data to found like as the COVID-19 patients data is not so much. I got like as 100 X-ray images about COVID-19 patient, but there is a lot of images normal people. But what actually I need to do, enlarge my machine learning model to enlarge my accuracy and prediction accuracy, how actually I can handle within 100 COVID-19 images. Please, if you can explain.
So that is actually a very interesting problem, and thank you for raising that issue. So as I mentioned that, well, a small data set is actually one of the main problems that we data scientists are having right now when we are trying to build a predictive model on detecting COVID-19 from images. So that is one of the biggest challenges. Now, some of the people some of the works that I have seen use actually the adversarial networks. Okay, so using adversarial networks, they tried to augment the data set. Well, but the results that they have reported was not something which was very promising. But that is a way which actually can be used and explored from the machine learning perspective. So maybe, well, if you would like to, if you're very keen on working on that, I think that the GAN, or generative adversarial network, would be a possibility for you to explore or augment the data set that you have. However, well, there is something not concrete, because, well, also the amount of data that you have might be those 100 images, that X-ray images that you are telling. The annotation is yet another problem. So we have very weakly labeled data. So there is a lot of data. Well, they say that this is COVID-19, but, well, the annotation exactly where they saw each the infection is not properly annotated. So that is something which is yet another problem. So yeah, well, I would suggest that you need to be careful and keep your eyes open, and when you build your model, take these things into consideration. Okay, so hope that answers the question. Yeah.
Yes, sir. Thank you very much, sir.
You're welcome. Yeah.
Thank you. Atik, I think someone, Atik M, is written. Would you please raise your question? This is the last question. Atik. Okay, I think he or she is not.
Professor,
Oh, yeah.
yeah.
Yes.
Professor Shamim, we can move forward.
Yes, yes. Okay, thank you. Thank you, Dr. Mufti Mahmud.
Thank you very much for having me here. It has been a pleasure, and I wish you all safe and healthy life. So Atik, I can see Atik is there.
I think his microphone is not working.
Okay, yeah. Anyway,
Okay.
so
Okay.
I wish all the participants to be safe, and thank you again for listening me. Have a nice day.
Thank you, Dr. Mufti Mahmud, for your time. And okay,